Berger's disease is also known as IgA Nephropathy. It's a renal disease. Look at this picture, shows that kidney glomerulus CT findings and ultrasound detail going on. Introduction. Berger's disease, also known as IgA Nephropathy, is a kidney disorder characterized by the accumulation of the immunoglobulin A IgA antibody in the glomeruli, the small filtering units in the kidneys. These conditions can lead to inflammation and, over time, impaired kidney function. Definition. IgA nephropathy or Berger's disease is an autoimmune disease where IgA antibodies deposit in the glomeruli, causing inflammation and potentially progressive kidney damage. Types. There are no specific type of Berger's disease, but it can be classified based on its progression. 1. Primary IgA nephropathy occurs without an underlying disease. Second, secondary IgA nephropathy associated with other conditions such as liver diseases, celiac disease, inflammations, or inflammatory bowel disease. Causes. The exact cause of IgA nephropathy is unknown, but it is believed to involve a combination of genetic and environmental factors, abnormal immunoresponse, leading to the overproduction of IgA antibodies is a primary contributor. Risk factors. 1. Family history of IgA nephropathy. 2. Being male. Men are more commonly affected than women. 3. Age. Commonly diagnosed in the teens to late 30s. 4. Ethnicity. More prevalent in Asians and Caucasians. 5. Certain infections, particularly those affecting the upper respiratory tract. 6. Liver disease. Complications. 1. Chronic kidney disease CKD. 2. High blood pressure, hypertension. 3. Acute kidney failure. 4. Nephrotic syndrome. 5. End stage renal disease ESRD requiring dialysis or kidney transplant. Pathophysiology. In IgA nephropathy, the IgA antibodies from immunocomplexes that deposit in the glomeruli. This triggers an inflammatory response leading to glomerular injury. Over time, this inflammation can cause scarring or fibrosis, reducing the kidney's ability to filter waste products from the blood effectively. Signs and symptoms. 1. Hematuria, blood in the urine, often visible as cola or tea-colored urine. 2. Proteinuria, protein in the urine. 3. Edema, swelling in the hands and feet. 4. High blood pressure. 5. Flank pain, pain in the side between the ribs and hip. 6. Recurrent upper respiratory infections. Diagnosis. 1. Urine analysis to detect hematuria and proteinuria. 2. Blood test to check kidney functions, creatinine and blood urea nitrogen levels. 3. Kidney biopsy, definitive test involving the examination of small kidney tissue sample under a microscope. 4. Immunofluorescence to identify IgA deposits in the glomeruli. 5. Imaging test, ultrasound or CT scan to analyze kidney size and structure. Nursing diagnosis. 1. Risk for fluid volume overload related to impaired kidney function. 2. Impaired urinary elimination related to renal dysfunction. 3. Risk for infections related to immune system compromise. 4. Imbalanced nutrition, less than body requirements related to dietary restrictions. 5. Anxiety related to chronic illness management. Disease management and treatment. First, medication. ACE inhibitors or ARBs to control blood pressure and reduce proteinuria. Corticosteroids to reduce inflammation. Immunosuppressants in severe cases to reduce immune system activity. Second, dietary changes, low sodium diet to control blood pressure, protein restriction to reduce kidney workload. 3. Lifestyle modification, regular exercise, smoking cessation, limiting alcohol intake. 4. A dialysis or kidney transplant in advanced cases with end-stage renal disease. Psychosocial medicine. Living with chronic disease like IgA Nephropathy can have significant psychosocial impacts including stress, anxiety, and depression. Support groups, counseling and education about the disease can help patients and their families cope better. Prevention. There are no specific measures to prevent IgA nephropathy. However, managing risk factors like hypertension, maintaining a healthy diet, and avoiding infections can help in reducing the severity and progression of the disease. In conclusion, IgA nephropathy or Berger's disease is a chronic kidney condition that requires careful monitoring and management. While there is no cure, early diagnosis and treatment can help manage symptoms, slow disease progression, and improve the quality of life for affected individuals. Thank you. Have a good day.